Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Here's what I bring to you all from the world of medicine. Can low advantage neighborhood lead to worse outcomes for kids with multiple sclerosis? People who develop multiple sclerosis as children and grow up in less advantaged neighborhoods may have a larger volume of inflammation and brain tissue loss on imaging than those who grew up in more advantaged neighborhoods, according to a study published in the online issue of Neurology, the medical journal of American Academy of Neurology. Our findings suggest that social disadvantage in childhood can have lasting effects on multiple sclerosis severity, said study author Kimberly A, MD of New York University Grossman School of Medicine. Childhood is a critical time for exposure to environmental factors associated with increased susceptibility to multiple sclerosis, such as passive smoke, pollution, and low sunlight exposure. More studies are needed to understand which and how factors in disadvantaged neighborhoods increase the risk for multiple sclerosis severity in young people. The study involved 138 people with an average age of 20 who were diagnosed with multiple sclerosis before age 18, known as pediatric onset multiple sclerosis. They had been diagnosed with multiple sclerosis for an average of 4 years. All had brain scans to measure areas of brain inflammation and injury due to multiple sclerosis and brain volume loss. Researchers collected information on social factors that may impact a person's health, including self-reported race and ethnicity, type of health insurance, parents' education level, and the degree of neighborhood advantage or disadvantage. Social factors associated with disadvantage correlated with greater volume of inflammatory lesions in the white matter of the brain and also with greater black hole volume, which is a sign of irreversible loss of brain tissue. Together, they identify social factors accounted for 26% of the difference in white matter lesion volume and 23% of the difference in black hole volume among participants. Once all factors were taken into account, having public health insurance was the strongest predictor of having greatest amount of inflammation and tissue loss. People with public health insurance had average white matter lesion volume that was larger than people with private insurance. They also had average black hole volumes larger than those with private insurance. The researchers found that differences were not explained by how soon children were seen by a neurologist, how quickly they were started on medication for multiple sclerosis, or how effective their medications were at slowing their disease progress. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.